Good morning and thank you so much for sticking with K24. I'd like to welcome you to our social hour. My name is Shiko Kaitani, saying a big thank you to Anki Doris for kicking off the show from 6 a.m., giving you the very latest on what is shaping headlines so far. Remember, we do want your feedback as well as your questions, whatever it may be, through our social media platforms at K24 TV on Instagram, Facebook, as well as X. You can see our WhatsApp number scrolling at the bottom of your screen should you wish to contribute to our ongoing discussions right here at K24. Now, before we jump into our topic, as always, Domo Lotto is here to hand over 100,000 Kenya shillings to a lucky winner. And we are doing this every hour at the top of the hour. You do know the instructions by now. If you have been watching K24, you simply send anything between 50 Kenya shillings to 1,000 Kenya shillings to the pay bill number 919155 with the account being K24. And so there is going to be a life-changing phone call coming your way, fingers crossed. If not, we encourage you not to give up, because it could be your lucky day today, tomorrow, the day after, who knows, by the way. But what we encourage you to do is keep on playing. With as little as 50 Kenya shillings, you could be a winner. Remember, the 55th edition of the Magical Kenya Open, which is the only DP World Tour event in East, Central and West Africa, is taking place at Muthaiga Golf Club from the 22nd all the way to the 25th of February 2024. Now, the Magical Kenya Open is the 11th out of the 45 events of the redesigned DP World Tour and is in its international swing, and is actually going to be following 2 weeks after the Qatar Masters. There's a lot of action happening as far as golfing is taking place, and of course it's going to be happening right here on your screen as well, because K24 will be covering this extensively. What we want you to do, if you are interested in obviously checking out all the golfing action this weekend, is go to www.kenyaopen.hustlesasa.shop, where you can get your ticket for Thursday and Friday at only 1,000 Kenya shillings, with Saturday and Sunday going for 2,000 Kenya shillings. If you're interested in a season ticket, it's only 5,000 bob. All right, so this week, or at least today on Health and Wellness, we're actually tackling dental care, and specifically when it comes to our totos. Of course, we do know that dentistry has an environment which can actually stimulate natural fear responses, even in adults, okay, but extensively when it comes to children. And of course, for various reasons, you know, whether it is the lack of maturity or poor communication, there's a lot that happens, obviously, in that space. And of course, if you are concerned about getting your child to cooperate at the dentist, I want to believe that my guest today is going to be helping you with that, so that you're not equally crying as much as that child is crying when you're going to the dentist. Well, he is your favorite dental practitioner back on the show. I'm talking about Dr. Philip Mwakazi from Gego Dental Care here in studio. Hi.
Hi, Shiko.
Good morning.
How you been?
I'm good. How are you?
Tuko salama. Tunashukuru.
How is everybody telling you about the superstar dentist that you've become?
I'm coping. It's not easy.
You have fans now?
I grow. Fan base may grow. Thanks to you.
You're welcome. No, you're doing a good job. So, I mean, anyway, it's natural. It's a natural response. I just, you know, if you haven't watched the show before with Dr. Mwakazi, he has such a passion for children. And when you're dealing with pediatric matters, it is highly sensitive. And so you can imagine the experiences, Daktari, that you've seen, probably everything under the sun.
Most.
With parents trying to get their kids to cooperate and sit on that chair.
Yeah.
But I'm just trying to understand in terms of the prevalence of dental fear and anxiety. Is it like 9 out of 10 kids will be saying, no, I'm not entering that chair?
Okay, 9 is quite high. I will give an index of about, let's say, 5 out of 10.
Yeah.
Okay, half of the number that I'm going to see. Okay. Reason why I'm saying this is because they are actually kids who are actually cooperative. Okay, they will come, they will have a very smooth run at the dental chair, the dental office. Okay, but now there are others. Okay, we still have 3 cadres.
Yeah,
there are those who are cooperative. There are those who are potentially cooperative. They're getting there, and there are those who are totally uncooperative.
Right.
Okay, so those are the kind of patients we actually see. Okay, but now, long story short, we purpose everybody to be cooperative. We want a 10 over 10 type of grading or rating for everybody, but we do have challenges. Okay, now when it comes to behavior management, there are 3 factors that play in. Okay, can be the guardian or the parent factor, now the patient or the child factor, and also the dentist factor. There are 3 factors actually play in. Okay, let me start with the parent. Okay, how you actually groom your child or what you actually seed into your child about dental visits really matters. Okay, there's one phrase that actually deceased. I think I've even done a small shoot on the same, where there's this statement people say, kula ama nitakula kwa daktari udungwe sinda. You have messed it up for us there. Okay, our head is already
that happens a lot.
Exactly, they already vindicated. Okay, so there's that that parent factor. Okay, what you groom, what you feed your child. Okay, now patient factor now. Okay, age group. Okay, definitely when you are younger you only have this type of phobias and anxiety. Common age group 4 to 8 years tend to be more rebellious. Okay, but also you will learn that there's also an age group, actually not an age group, actually a group that actually has it difficult coping with us, the special needs group. We shouldn't forget this, people. Okay, there are especially differentially enabled caliber of people who are with us, and we need to accommodate them. Okay,
true.
There are many conditions that we have. We talk of autism, we talk of cerebral palsy, ADHD, just to mention but a few. These are people, you must accommodate them. They need dental services. Okay, they are special in their own way, but you also have to handle them in their special type of way. Okay, now that's both the patient, the child factor. Now the dentist factor, which now I play in. Okay, now basically dental office, okay, where they walk in. Okay, try to make it more have the ambience, how to have it more welcoming. Have a cordial reception to them. Okay, talk to them. Now they have walked into the office. Okay, what will you do as a practitioner? Okay, you must be welcoming, you must be understanding, especially understanding. Okay, because if it's a 4-year-old who's all has had lots episodes of pain, they are crying, emotional just off the roof, you have to bear with them. You can't just tell them, excuse me, I can't see you today. You have to take time with them. Okay, and then now eventually it's a triad. Okay, in cooperation with the guardian and the parent, and coming together, and also the patient now as the key factor, we have to work together to have now the favorable treatment for you. So behavior management is actually multifactorial, it's multidisciplinary. There are many things that will play in place to actually have the favorable dental visit.
And would you look at that, the evolution of science, because now there's so much psychological support coming into this. I mean, back in the day, this was not even a discussion. You're either getting on that chair
or not.
You are going to see the nurse and you're going to see the nurse, right?
Yes.
But this is where the question of why is this so important, an essential part of dentistry today? Why is it important to actually have this as a discipline on its own? Yes, there's the skill set for you as the doctor, you know, you have your tools, you know what you're doing. But then now getting to the emotional and psychological aspect of your patient, a key factor.
Now, there are several points, but I'll start with one, okay? First, people actually avoid dental visits based on their psychological background, okay? The fear, the phobia, the past maybe work or unfavorable dental experiences. So you have to emotionally tune this kid from the youngest age possible, so that when they're adults, they have no problem just walking in to a dental office. Because this is now the implication that comes in, okay? You have a dental issue. Based on the phobia that you have, you don't want to have it addressed sooner. So you actually pass time, waste time, you're just having two thoughts about visiting your dentist, things worsen. Remember, bacteria don't know that you are buying time. They won't buy time. They'll continue doing whatever they are doing as you are there just buying time. Okay. And then again, we want people to appreciate dentistry. Okay. Remember that we are trying to make you be your own boss of your own treatment, okay? Have your own volition, saying, yes, I need to go for my dental checkup.
Yeah.
Yes, I have some sensitivity, I can have it checked. Because remember what, when you spoke last time,
Right.
we say as you buy time, even the cost of treatment tends to soar.
It does.
Okay?
Yeah.
What you had 6 months before and now is actually different, okay? So it does you good, and also for your futuristic dental visits, it makes it better for you. So that's how we start behavior management with children. We tune them, we mold them. In Kiswahili they say samaki mkunja ngali mbichi. The earlier the better, okay?
Right.
Because at a more mature age, it may be more difficult to actually convince you about dental visits and procedures.
It's true. And even as an adult, when you think about it, people just keep postponing. There's a lot of procrastination on going for your dental visits because you're thinking, do I really want to deal with the effects of a root canal?
Exactly.
No, I don't. It's okay. It can wait.
Yeah,
but that's the wrong approach.
Yeah.
What typical scenarios, because we want you to paint a picture, assuming we're there at the clinic with you, what are the typical scenarios of uncooperative patients do you see a lot?
Okay.
Yeah.
Yeah. Most of the uncooperative patients in typical case, mostly have a current symptom they're experiencing, which is mostly pain. Okay, so when they've had pain for about a week or two previously, so when they come to already your chair side, they already think you're going to actually exacerbate or worsen whatever they're experiencing. Okay, so they already have a bad experience, the pain, the swelling, sensitivity, just to name but a few. So they typically come already having a type of phobia or PTSD previously, okay? Number two, some may have had a bad previous dental experience. It is common, okay? Maybe the last visit they had, maybe when they are young or whenever they can remember, wasn't the most suitable experience that they had. So whenever they just come for a checkup, they already have the memory of whatever they experienced.
That's true.
Yeah, so it can be a current symptom, a past dental experience. The third case, which I'm saying is now a special case, people who just have actual special or differently enabled, okay? They're just not cooperative, okay? Like you really try to retrain them, you really try to convince them, but it's just them, okay? It's their God-given nature. They have anxiety, they have fear, they have phobia, okay? You are a new face to them, okay? So they're not comfortable with you, okay? Those are most of the cases that I mostly find. But
and what's the worst you've seen? I mean, like a case that actually has been etched in your memory and you're like, where? That patient. Hey.
The worst case, if I can give it a worst case, I will not mention special needs. I'll never mention them. Those ones are just they're just differently enabled, okay? But if you're a potentially cooperative child, okay, there are some who are just they're just difficult. They're not to be cooperative at all. You could even have some unfavorable traumatic cases. They may try and engage you in a punch or two.
Oh my goodness.
But you know, you have to understand them, okay? But now that's when the parent comes in, okay? Because you know, if you know this is just child that has decided not to be cooperative, just being difficult, the parent should assist me in this, okay? That's something also the parent or the guardian factor comes in. Should try and assist and tell Toto, don't do that, okay? That's bad, okay? Sit down. Doctor wants to help you, etc. Okay? Because there are some, those are people I can say that actually are the most disturbing cases I have found, okay? You know, it's not a tough procedure. You just want to become difficult. You just want to become, for you now, we may actually now disagree, chair side.
So parents play a very big role, or guardians, when it comes to, you know, how treatments are administered or procedures are done on their children. Speak to parents right now about how to assist healthcare professionals do their job.
It's very simple, but nothing really difficult, okay? Number one, you spend more time with the kid more than I will spend.
Of course.
So whatever time you have with them, reinforce their oral hygiene, reinforce their discipline, reinforce their cooperation, okay? Because I'm sure there's that look, you know, that African look moms give you. I've seen it in the, just give you that look and you just cooperate, So it is instilled from home, okay? So long as you instill it at home, it will be easier for me. And also chair side, after I explain to you the procedure is going to be done, kindly just be on my side, okay? Because sometimes, if you're not on my side, I don't know who is.
Kindly be on my side.
Kindly be on my side. I'm not trying to help you, okay? The child may be anxious, in fear and everything. But if you're on my side, you're going to help me assist the child get treatment. It's going to be much easier.
You're right.
So you're going to be 3/4 in.
Absolutely, absolutely. It's very interesting to see how even beyond dentistry, for example, moms who are watching here and they have their, wellness baby checkup thing. It's the same concept, how are you going to let the nurse touch your child if you yourself
you are not
like, no, about that. You go into the triage, do your thing, and then bring me back the child when. So misconceptions around dental treatment, honestly, are usually the cost factor.
Yeah, cost factor.
But what you're telling us today is that this is a whole new ball game altogether. So it's not just about finances.
Yeah.
People could actually be avoiding the dental chair because of anxiety.
Yes, phobias are there. Phobias are there a long time, okay? We actually are grateful because of advances in technology.
Yeah.
Because if you go to your history books, there was a time there wasn't anesthesia, chair side, okay?
Oh, wow.
Yeah, it was all about to restrain, you have your procedure, okay?
Yeah.
Also, you can remember the professionality that has come with dentistry, okay? The relation, interpersonal skills.
Yes.
Actually, the hygiene, okay? Because let me give a very fun fact. People used to have their teeth uprooted at a barber shop. Do you know that, Shiko?
Oh.
Back in the day, yeah, Google it's there. Because it was just, I will trim your hair and I will pluck your tooth back in the day. But these days, the dental office has actually evolved, has actually mutated to be somewhat more welcoming, okay? We do lots of talking. The technology is there to actually boost your visit and actually give you the best results in the shortest period of time, okay? Because even another thing where I've been shared about time, kids, their attention span is quite short. So when you're there chair side, you really want to maximize at the shortest period of time. Okay. So with the advancements in the practitioner skill, we have the much treatment done at the shortest span of period that we have with the patient.
I'll be asking you about obviously some of the strategies that you actually apply at your clinic so that you're getting maximum results out of these sessions that you have with your patients. But let's just remind our viewers to send in any questions they may have in regards to obviously your child's dentist or rather dental visits rather. If you also do have comments that you would like to send through, we do have our WhatsApp number at the bottom of your screen. Start texting in and we'll be sampling them in the second half. Obviously, in terms of letting you know about the good vibes and good things that are actually at your fingertips, remember there's also Dental Cool that we have been partnering up with as K24. That specifically formulated cooling ingredient that Dental Cool has. Yes, it's been such a big hit in the market. Dental always continuing to remind us about good hygiene being key. What you do need to understand though is that there are incredible deals ongoing courtesy of Dental Cool, and they're actually at your nearest supermarket, so it's not a situation where you actually have to go out of your way. Just head on down to your local supermarket and be able to take a look at what Dental Cool has on offer. All right, so I just Googled, by the way, the fear of the dentist. It's called dentophobia.
Dentophobia.
There are people watching this show, and saying, okay, fine, I can't go to the dentist. What you have is dentophobia. But let's also just stress a little bit about why it's important to find a good practitioner. Because if you're even using the term PTSD, when it comes to surely your dental care, you must be really traumatized. And it's because perhaps, who you went to see was not as professional. And you see that a lot.
We see that a lot. Okay. Now, there are skills that we actually implement to actually bypass some things, okay? You have the worst of phobias, you have the worst of anxiety, no problem, okay? Now, there are two categories, okay? There's what we call pharmacological and non-pharmacological. Pharmacological is basically drug-induced, okay? And there's non-pharmacological, okay? What I will actually implement, okay? Just to give a summary, pharmacological means I have to use maybe a drug. Even people even need anxiolytics, okay? There are drugs which actually temper down your anxiety, okay? In worst case scenarios, we may always do conscious sedation, okay? Where you actually bring an anesthetist in, we actually sedate you, and even in some cases, even general anesthesia. But I won't delve into that today. Now, the non-pharmacological is what now I will be doing as the dentist, okay? Number one, communication. What I'm even doing, okay? I will explain to you this is a glass with water. That is I'm taking you in. The water may be warm, the water may be cold.
Yeah.
So that simple breakdown will assist you to actually actually have a smooth transition
Yeah.
into the chair. So communication is key. Okay, I have to give you a history of whatever you have, what needs to be done, what you'll experience now and even after. Okay.
Right.
Now for kids, okay, it's now this is now specifically tailored for kids now. I can even model for you, okay?
Right.
When you come maybe as a parent with your child, I would prefer you as the parent to first sit on the chair, okay? Why will you sit on the chair? Say, Daddy, this is how you'll sit, or Mommy, this is how you'll sit. Look, there is no pain.
Yeah.
The doctor will just come in, have a look, 1, 2, 3. This is a mirror, this are gloves. Just you're modeling on behalf of the child, okay,
Right.
to be more comfortable,
Yeah.
okay? Another thing is what we call reinforcement, okay? You have to reinforce whatever they're doing. They have said, very good. Clap for Toto.
Right.
Good, you are doing this. Oh, you have opened your mouth. Wonderful. You reinforce. Positive reinforcement,
Right.
okay? Now, this is the best case scenario, okay? Sometimes you have to do what we call negative reinforcement, okay? Maybe I want to reward you maybe with a balloon. Like commonly balloons are really available in our facilities. If you don't do as I intend you to do, I withdraw.
Yeah.
It's called negative reinforcement, okay? If a child is problematic, potentially cooperative mostly,
Right.
okay? Like you just need to make them just to come to your side. You can even do for voice control.
Yeah.
You know, you have to establish dominance, okay?
Right.
Sometimes maybe when when your voice is just too low, they are just taking, this one is easy peasy. No, you have to raise your voice sometimes. It's called voice control
Right.
to establish dominance at the chair side, okay? Sometimes it has to be a whole training process, something called retraining. If someone had a bad dental experience, you know, you have to reprogram
their
the child.
mindset.
So it's called retraining, okay?
Yeah.
You do a treatment plan and you take them in phases,
Right.
okay? You retrain them, you make them have a new experience of the same, okay?
Okay.
Now, there are more repressive measures that we do, okay? When we call them repressive, they're quite, they may not be favorable to anybody else, okay? You're actually uncooperative at all. You are in pain, the child is in pain, needs to have the tooth checked out or has had a pulpectomy or any invasive procedure, okay? They need to have, it's a more urgent. So their cooperation is not forthcoming.
Right.
What do you do? Things like called hand over mouth.
Okay.
If maybe a child just screaming, you say, I'm going to place my hand over your mouth. I'm only going to remove it when you stop screaming, when you stop yelling.
Okay.
It's called hand over mouth.
I like that. Okay, hold that thought right there because I want you to explain a little bit more about hand over mouth. These are great techniques that you're sharing with us, and I believe there are other practitioners who are also watching the show. We want to take a short commercial break because Dan has ordered me to. But when we get back, obviously we'll be sampling your text messages. Remember, Dumu Lotto is still ongoing. You do have those instructions. We're asking you to send anything between 50 Kenya shillings to 1,000 Kenya shillings through the pay bill number that we have been providing for you. And of course, that account number is, or that account is K24, okay? So when we get back, there's definitely more from Dr. Philip Mokazi as we talk about how to deal with your totos at the dentist. Welcome back to Health and Wellness with me, Shiko Kaitani, on K24. We appreciate your company every morning. If you just tuned in, well, karibu sana. You do know our socials are right there on your screen, as well as our WhatsApp number. Should you wish to actually send a text message in, a comment or a question, karibu sana, we appreciate it. Shiko Kaitani here with you, having a great time with Dr. Philip Mwakazi in studio as we talk about behavior management in children at the dentist. And for the 80th time, no, this is not Johnson Mwakazi's brother, okay? This one is the dentist. The other one is from the makers of Super Sato. So this is the Daktari, the other one is in media, okay? No correlation, we promise, by the way, but if there is, he needs to tell us. But every time you come, everyone always asks me, oh my gosh, is that Mwakazi's brother? No.
Even at times I even doubt. I'm like, going to ask back at home.
All right, so Daktari was just about to give us more strategies on how to handle problematic children at the dentist, right? And so he'll be sharing some of his tips with us as we move along. But remember, we are going to be giving away 1,000 Kenya shillings through our Dumu Lotto competition at the top of the hour. We're looking for a bonus winner. Stand by, our team could be calling you. That being said, you can see the instructions on your screen. If you haven't started participating, that's how you go about it, by sending what you can between 50 to 1,000 Kenya shillings to that pay bill number on your screen, with the account being K24. Please be on standby. You never know, it could be you in the next 30 minutes walking away with our 1,000 bob. All right, Dettol, as you can see behind me, we've got some great products courtesy of Dettol, and of course them reminding us that hygiene is key. We are pushing Dettol Cool, to be specific, and they've got some really cool products here. You can see behind me, no, this way, yeah. There's the disinfectant, you can see the hand wash, you can see these soap bars that are always going to be giving you that revitalizing, hygiene, clean kind of feel, okay? And what Dettol are reminding you is that right now there is an ongoing campaign of super deals at your supermarket, okay? So make sure obviously to grab a whole family pack for you and your loved ones as Dettol continues to push the good hygiene campaign. All right, Magical Kenya also doing some great things this weekend, and we're talking about obviously the 55th edition of the Magical Kenya Open. That is the only DP World Tour event happening in East, Central, and West Africa. Now, why this is such big news, especially if you're here in the capital city, is because it's happening at Muthaiga Golf Club from the 22nd all the way to the 25th. If you are interested in all this golfing action, we want to encourage you to get your ticket for 1,000 Kenya shillings for both Thursday and Friday at 1,000 Kenya shillings, and of course for Saturday and Sunday 2,000 Kenya shillings, with season tickets going for 5,000 Kenya shillings. You may be wondering, how do I access or how do I get my ticket? Well, go to www.kenyaopen.hustlesasa.shop. All right, hey Mwakazi.
Yeah.
Take over. Nimeongea.
Okay.
All right. So yes. So you were telling us before the break that one of the strategies when you have a child who, to be honest, is just having a total meltdown at that chair. And I'll also blame you guys. Why do your tools look so scary?
Tunajaribu. We are trying to actually reshape them.
Yeah.
But this is what we have at the moment.
Well, you come at me with a hook. You come at me with a machine that's gonna suck something out of my mouth, and it's
true. Yeah, we'll get there. We're getting there.
It's also your fault. You guys need to figure that out. But anyway, 5%. 5%. So if you have a child who just isn't, participating, cooperative, you talked about having this technique called hand over mouth.
Okay. Now we have agreed this patient is uncooperative. Yeah. Okay. So the measures tend to be more repressive now, okay? Because now we have to do this treatment, okay? It's chair side, and they need to model you to come to my side, okay? So why is it hand over mouth? Mostly the child is yelling, they are crying, they are screaming. It's all the chaos, okay?
Right.
So you actually place your hand over the mouth of the child, okay? And it comes with instructions, okay? Like mommy or daddy, I will only remove my hand after you have stopped screaming or yelling.
Yeah.
More like negative reinforcement type of way. So what I'm saying, okay? So we use that mostly to control a chaotic and a child having the, what we call the meltdown chair side, okay? Now, it works, it may not work, okay? Now, there's one that now even can even push us to even more repressive measure, okay?
Yeah.
3-year-old, 4-year-old, okay, it's just crying and wailing, okay? We may need what we call physical immobilization or physical stabilization,
Oh, wow.
okay? You actually may need to restrain the child because the child, you can't negotiate with him or her, okay? It's totally uncooperative. You may ask the parent, with the consent, there must be consent from the parent or the guardian, okay? To actually help you restrain the child, okay? Because now, we have got to the point where all positive communication positive has actually is not working for us at the moment, okay? So what we call physical stabilization. It's actually a technique that actually needs a professional to do it, okay? Mostly the person who's going to actually stabilize the kid is the guardian or the parent who's actually brought them chair side, okay? If we may need some reinforcement or people to actually assist us, we do it, okay? But this is now in the worst case scenario, okay?
Correct.
Because now the cooperation is not any forthcoming. We just have to do the treatment and progress. But all you must, the parent must learn, they must be on our side.
They must be on your side. Okay. Mokazi, let's take a look at feedback. Tafadhali Dan, let me sample 1 or 2 or 3, if whatever is there. Yeah, let's see what we have here. Okay, let me see. Okay, fine. There you go. All right, so I think this one is from Evans. Hi, Doc. My son has had the biggest fear of going for dental checkups. This was after our last stop to deal with a cavity, which was extremely painful. Now I have to buy him something every time we go to the clinic or to the dentist. Okay, so Evans is using the reward system.
Reward system.
So are you for that? Telling parents figure out how you're going to more or less manipulate your child.
You have to maneuver, okay? I like what Evans is doing, okay? Remember I say this thing is multifactorial, multidisciplinary, okay? Now him as the guardian and parent factor is doing very well, okay? What he's doing mostly the positive reinforcement he's doing. Maybe if a child decides to have a visit, he'll reward him, okay? What I hope he is rewarding is actually something that is not sugar-based, because if you're rewarding him with sweets and the child has a cavity, it will be negating, okay? But any reinforcement will work a long way, okay? Now, I think I even mentioned this. When the child comes, when Evan says son or daughter, whoever it is will come, we'll do what we call retraining, okay? We'll purpose to give him or her, the child, a better dental experience, okay? From the where they walk in, from the reception to the nurse to the dentist, okay? Because what this child needs is actually retraining, okay? You must help him or her forget whatever they had. You tell them, by the way, we have a better, you can have a better experience chair side. So it's doable, but whatever he's doing is actually perfect, okay? It makes it easier for us to come here. But if he was part of the backlash, procedures are painful, uncomfortable, expensive, you know what I'm saying, all such of backlash, definitely will not get to the chair.
It's
true. So whatever he's doing is good, and us will do mostly the retraining, as I mentioned earlier.
I love it. Thanks, Evans, for that. Let's see something else that came through our socials that we do have that we can sample. This one is from Bertha, who said some staff at dental clinics are simply rude and never have any patience with children, hence why they never want to go near a clinic. Can't staff be better trained on handling kids?
They can. Now, thank you for that comment, but now, as I say, number one, it starts at the doorstep, at the reception. How they are received from the reception will really open up the funnel towards the dental chair, okay? Now, human is to err, it's a human nature. We may be having a bad day, not it's not to fellow practitioners or staff, okay? But really try and wall off. Remember that you're really trying to have a cordial environment for your patient. They may have a bad day, you may have had a bad day, but just try and reprogram yourself to give them the best of experiences. I'm not perfect. I'm sure even there's some patients who say, they didn't have the best of experiences with Dr. Mokas. I know they are there. I'm not perfect, okay? But we really try to give you the best of experiences, okay? That is why there's one factor that I mentioned first when you're talking about behavior management, communication. Because if you come in, sit, sign, walk in, we are pulling out. Poor communication, we are going to have a shambles there. Communicate, okay?
Yeah.
Take time to educate. Take time to inform, okay?
Right.
If there are any underlying factors, you know, we usually say at the dentist, we're not treating the tooth. We're treating the person holistically.
Right.
Okay.
Right.
Maybe the underlying factors. Why didn't you come to the dentist soon or earlier?
Yeah.
We'll tell you maybe I had financial issues. So you have to think, financial is a concern here. Why didn't you come to the dentist? I've had a bad dental experience. Sorry, training is key.
Yeah.
Why didn't you come to the dentist sooner? I have fear for needles. It's called belenophobia. You look it up. Yeah.
Okay.
People fear the injection of the needle. So you have to take them through that
Right.
to bypass all that. It is doable, okay, but it needs time, okay.
And through that communication, you're able to assess what the problem is as to why people are delaying their treatment plan.
Yeah,
because everybody has a different story.
Yeah. Everyone has their own story, can be their own course, but if you get to the bottom of everything, best believe me, you know the solution.
Okay.
Because if you come and tell me maybe it's a financial factor, and then I just write down, don't worry,
Yeah.
I'll even give you a discount, I'll even give you a good payment plan or something.
Yeah.
No, it's going to be easier even if you come for a consecutive dental visit.
Right.
But you must get the root of things.
And you know, when you look at, not just people like you who are dealing with pediatric dentistry, I mean, look at a facility like Gertrude's, for example. I mean, it's crazy. I mean, you can work as a healthcare professional in any other hospital, but it takes a special touch when it comes to dealing with kids. And I want to believe that practitioners such as yourself invest heavily in creating the right environment for children. It's not cheap.
You have to invest the interior.
The environment needs to look the part so that kids can actually feel
comfortable. You have to have the cocomelons and everything. Now, even to come up now, I mentioned cocomelon. There's another measure or strategy is called distraction.
Right.
It is very common now.
Yes.
If a child walks in, you just ask mom, what does he or she love listening? Music?
Yeah.
Cocomelon, watching Cocomelon, Paw Patrol. It's called distraction.
Right.
If you see communication not really working and they're good with distraction, you may have to have something on the screen there.
Yes.
A cartoon like on my waiting room, I just play cartoon 24/7 most of the time.
Yeah, look at how in touch you are with them. You know them all.
You have to work around it, okay? So distraction can actually work.
Right.
The Paw Patrols, the Cocomelon, the SpongeBobs, it will assist you and make it easier for you.
Oh my gosh, she's about to break out some nursery rhymes here. Another text message, as of course we start to wind down, Tafadhali Dan, and then we can also continue with our conversation here and say Kwaheri. Joanne, thank you. Who goes on to say, I'm currently a nurse and children must be handled with care. You are the reason children fear the needle. You just talked about that. Or tolerate it. It's all part of the job.
Now, I think I will repeat something just to speak in a minute or two.
Yeah.
The needle is actually your friend. I think I mentioned it in the last time we were together. The needle is your friend. But now there's a dental factor.
Yeah.
How you actually introduce the needle to the tissue. Communicate, okay? Right. There's going to be a mosquito prick, there's going to be a small discomfort. Inform the patient and the mom that this is coming through. Topical anesthesia before you have your local anesthesia, okay? The spray will make the local anesthesia more comfortable.
Yeah.
And even, as a dentist, the technique of you administer the anesthesia, I think I covered it last time.
Yeah.
The slow gentle release into the tissues will make it much more comfortable for the child. So there are many factors around it. Yeah, we are really trying to bypass the local anesthesia, no technology yet or advancement yet, but anesthesia is actually your friend. It makes it bearable for you. Correct. It makes it most procedures have comfortable as you're there chairside.
Correct. Yeah. All right, I read somewhere that, and this is another dental practitioner. It was like, a report that was done. And let me just quote this, or at least paraphrase. He went on to say that although operative dentistry may be perfect, the appointment is a failure if a child departs in tears. So what I'm getting from this is that even for you as the practitioner, you don't feel 100% if a child is walking out dissatisfied, stressed, full of anxiety, full of tears, and has just left with a really bad experience. Yeah.
No, let me give you, there's a general term that we use, not only for kids, even for adults. Yeah. Let me call the patient burden. Okay?
Patient burden, okay.
If I treat you today, and maybe I start a root canal, just as an example, and then you call me at night, Daktari, I'm in pain. Yeah. It's going to actually disturb me, because I did my best to actually have this problem sorted, but you are in pain.
Right.
It's called the patient burden. Similarly, even for kids, okay? You want to have them walk out having at the dental office having a
smile.
no tears. There's no tears, a smile. They're just comfortable. But we go about it. Now this will call about the patient discharge, okay? You have physically stabilized them or hand over mouth, but you've had the procedure down. Obviously, the child is still dramatic, crying, etc. Don't discharge them when they're there. Talk to them, okay?
So until
Talk them,
they
until they calm down. Don't just discharge them. You're done. You can leave.
Patient.
No. Give them time. They will calm down eventually. No, they will be crying for the next 1 week. No. Those 20 minutes that it takes them for them to actually calm down, ease off, take them at the chair side. Because even if they walk out and there are other kids in the waiting room,
that affects the whole...
It messes your whole day.
Yeah.
So try as much before the child leaves the dental office or the dental chair, they already calm down.
Okay.
Give them a balloon and they're there smiling and walking on.
Tell me, because we always forget to ask the doctor who's checking up on the doctor. You know, we also forget to ask how the doctor is feeling. Yes. When you work in such a high stressful environment, Daktari, because I don't know whether or not, because for me who has my toddler and I go to places like Gertrude's or for Mpisha, for example, and it's like the numbness is just in all of you, because kids are screaming everywhere and there's a lady who's on the phone, hi, Sasa, you know, like her day is moving on and you're wondering, how is this woman coping with kids literally screaming from the triage all the way to the you know, into the procedure room. So for you, how does all of this, when you have children, you know, highly stressed, how does this affect you guys as practitioners? How does it weigh on you?
It does affect you. Can be a trigger also. But mostly I say, as I said again, learn to wall off, okay? You may need to develop some thick skin for yourself, okay? Remember that this is part of the profession, okay? It is expected, okay? If you need a timeout, take a timeout. Take a break, just take a walk to the balcony, breathe some fresh air, and then come back, okay? Because remember, they will never understand or actually know that you're having a bad day personally, okay? But because when the patient comes to you, definitely needs assistance from you. So the back stops with you, okay? Many a times, maybe if you need more support, you may consult or even call or ever ask aid from your fellow practitioner how to assist you. Because I have some colleagues who even call me to actually, if they see this case they can't handle, could even switch practitioner, maybe change of face, maybe they want just they want a shiko there, we'll talk to them nicely, look for that shiko, talk to them, you finish the case. Because remember, you can't be ice cream to everybody, you can't please everybody, but remember, the buck stops with you.
Absolutely. Let me give you this opportunity to actually let people know how they can reach out for a consultation. Like I had said, Dr. Philip has such a passion for children. And so when you talk about pediatric dentistry, he's right up that alley. And he also does have a lot of resources for your child to just get familiar with a dental clinic and to ease that experience for them as they start their journey of going to the dentist. Go ahead, Makazi, and then we can say goodbye.
Okay. So it's Gego Care Dental Clinic. We are in Totalu, Tawala, and also we're in partnership with Kilimani Children's Clinic in Kilimani. You can find us in either, okay? You can reach us out on Instagram, Facebook, and X, okay? It's Gego Care Dental Clinic. We're available there. Also, I will say, for children, the earlier the better, okay? Work on their emotional attachment towards their dental visits. Work on actually them being motivated to actually visit their dentist. It's going to work for them easier in their teenagehood and even their adulthood. It's going to be easier. And dentists, we are friends. Remember, we go through, we bypass it.
Thank you so much, Philip. You're always such a ray of sunshine and good vibes when you come to the studio. We love having you here. The bottom line is your fear and your anxiety could be the very same thing stopping you from accessing the kind of treatment that you require. And of course, delayed treatment, like Daktari is saying, is what could actually make things worse for you. So we want to encourage you today to get over your fear. What is it called again? Dentophobia. Get over your dentophobia today, okay? Bless you, Dr. Philip Mokazi, for making time this morning. To all of you who were participating on our socials when we actually promoted this particular discussion, thanks so much for your feedback. We appreciate it. My name is Shiko Kaitani saying saying thank you. We'll see you tomorrow bright and early on K24. I'm going to hand over to my sisters on the other side, which is Sarah Ibrahim and Ann Stella, as they get interactive. Bye-bye.